22-year-old Gravida 1 Para 1 to history of fever, severe vaginal bleeding, delivered a healthy male boy, and temperature is 38 now, and the cervical examination shows open cervix, heavy vaginal bleeding, ultrasound shows uterus, no retained placenta, no large thrombi. Operation is required to control the bleeding. So in this case, ligation of which one of the artery is important? So this is internal iliac artery. So let's break it down. So the patient is suffering from postpartum hemorrhage in this scenario. So the key point here is severe uterine bleeding, no retained placental products. So the issue is most likely uterine atony or vascular bleeding that is not responding to conservative measurements, requires surgical control of blood supply. So why ligate the internal iliac arteries? So internal iliac artery core concept involved the uterine artery is the main blood supply towards uterus. It's a branch of internal iliac artery. Remember that this is the high yield question here. Uterine artery is a branch of internal iliac artery. So instead of trying to ligate small distal vessels, surgeons go upstream. Mechanism very important for the Usmle point of view is ligation of the internal iliac artery reduces the pulse pressure to pelvic organs by 85%, converts arterial flow more likely venous low pressure flow. This allows clot formation and stops the bleeding. Not completely stop the bleeding flow, but reduces the pressure enough to control the hemorrhage. So why not just ligate uterine artery? Sometimes uterine artery ligation is done first, but in severe uncontrolled bleeding, anatomy is distorted, bleeding source unclear, so infection can present. So internal iliac ligation is more effective as compared to uterine artery ligation. Why other options are wrong? Ovarian artery is not ligated because it's a minor contribution towards uterine blood supply. So the external iliac artery supplies lower limb, not the uterus. Remember that external iliac, lower limb. Vaginal artery alone, too distal, insufficient control. So the clinical takeaway in this question is in severe postpartum hemorrhage not responding to medical therapy, uterotonics like oxytocin and misoprostol, uterine massage, balloon tamponade surgery, uterine artery ligation, internal iliac artery ligation, best next step if severe. Hysterectomy is the last resort. So the one line memory is control the pelvic bleeding, go upstream and ligate the internal iliac artery.